Hey, this is Dr. Lance Hamilton coming to you today from Jolie Aesthetics and Hamilton Concierge Medicine. I'd like to talk today about male sexual dysfunction. There are several causes of male sexual dysfunction. Men will come in and see me in the clinic and they will say that they're having a hard time getting an erection. And one of the questions I will ask them is, do they get an erection at night or in the morning when they need to urinate? And if they tell me yes, it's probably not a physiological problem, it's probably a psychological problem. And in those cases, either being treated for depression or going and getting some psychological treatment for whatever that person's going through will help that. It's also been shown that in studies for men who are showing whatever sexual inhibition, that pills like Viagra and Cialis have been shown to help, because the male can get the erection and go ahead and start having sex and work through the inhibition and get more confidence during the sex act. But essentially, the primary way that a male has to be treated for sexual dysfunction caused by psychological problems with psychological treatment. So the other problem, of course, is structural or physiological. It has to do with aging in most men. There are several causes of men physiologically not getting an erection, one of which is caused by low testosterone. And that's an easy fix because we can just check your blood, and if you're low on testosterone, we can give you testosterone replacement. That's been done for years. So that's not new. But what I found is I start men on the testosterone, and of course it's because they're older, and they still don't get an erection. And we go through all the questions about any psychological stressors, and they don't have any. In that case, the primary problem at that point is blood flow. In males who have diabetes or hypertension or cardiovascular disease, this can be a big problem, because when you have vascular disease in one part of your body, you're going to have it in all parts, especially if you're diabetic. And so what we've used for these males in the past, before Viagra, they would have to either take manual injections of chemicals into the base of the penis to cause an erection, which didn't always work and really wasn't something men were excited about doing every time they had sex. Or they would go and get a penile implant. Well, penile implants, there were thousands and thousands of those done. And I can remember taking care of a lot of patients that had those, and they malfunctioned, and the pumps quit working, and they would have to be reoperated and fixed, or they would get infected and have to be removed. So like with any surgical implant, there are a lot of complications that can happen. Well, when Viagra and Cialis came out, that solved a great deal of the problem, so that men did not have to go to using the injections into the penis, or getting a procedure performed. They wouldn't have to get a penile implant. Well, Viagra and Cialis worked for the majority of men and solved their problem. But in a significant number of men, I don't care what dose they took of the erectile drugs, they still couldn't get an erection. And some of the men who took these pills would be able to get an erection for a while on the pills, and then they quit working. And it's because you're trying to treat a structural problem of not enough blood flow with a pill that can only treat it temporarily. At the present time, there's no surgical way of doing anything about that. So, a physician who invented what's called the vampire facelift in southern Alabama also came up with a way to use what is called platelet rich plasma to inject into the penis to start growing new blood flow into the penis to help a man gain an erection. And here's how it works. We take a male's blood and we spin it down in a test tube. And we separate it into two components. One half of the blood is separated out, and that's your red blood cells and white blood cells. The other half is your plasma and platelets. Platelets are the tiny particles in your blood that help you to clot. If you cut yourself or skin your arm, the first things that rush into those holes in the arteries and into the torn tissue are platelets, and they form a plug. Those platelets are then activated and they send out chemical messages to stem cells to come in and build new fibrous tissue to plug the hole permanently. And then even more stem cells are brought in to help build new tissue, so that, as you've seen when you get a scab on your knee, sooner or later the scab falls off and you look underneath that and there's brand new tissue been grown. Well, stem cells did that, and it all started with platelets. So for the last 15-20 years, orthopedic surgeons have used platelet rich plasma, and they have injected it into joints, or they've put it into wounds that were hard to heal. And on the wounds that were difficult to heal with any other method, it would help them heal these wounds, because it chemically would call up stem cells to come in and fill in the hole. And it was miraculous. It would help save people from losing a limb. And on men who were, and men and women both, who were trying to stay away from getting a knee replacement or any other joint replacement, they would inject this material into that space, and it would call up stem cells to come in and build new tissue. And so it puts off and delays people from having to get a surgical procedure performed to treat the arthritic joint. Well, Dr. Runels came up with a method where he uses this same platelet-rich plasma and injects it into the penis. And of course, you don't do it every time that you're having sex, you just do it this once. And that's hopefully all you'll have to do. There are some men that have to come back in 3 months and have it done again. But in the majority of men, they'll have one treatment. And this injection of these platelets into the penis will call up stem cells to come in and build new blood supply and new tissue in the penis. The area that it's building this new tissue is called the corpus cavernosum, and that's something you don't care about, but for men, it brings in new blood supply. And in men who are currently taking Viagra or the other erectile drugs, it can help them, while they're taking those pills, to start getting an erection again, and a full erection. In men who don't want to take the pills, it helps them start getting erections, so they don't even have to take the pills. And in some of the men who are on Viagra or Cialis, they find that after they've been treated, they don't even need to take those pills anymore. So the object of this procedure is to use your own body to generate the healing of your own body. And so the side effects are almost none, because we're using your body, your own blood, to come in and stimulate new tissue in your penis to give you increased blood flow and solve the structural physical problem that's there. Now, in a male who comes in, I'm going to put them through all these questions on sexual dysfunction. And if it's a psychological problem, we'll deal with that first. If it's a physiologic problem, meaning if the testosterone is low, we treat that. But then if after treating that we find that's not helping the problem, when we determine that it is truly a vascular problem, we can do this injection, and you may not have to use the pills, and you will of course continue with your testosterone therapy, because the testosterone is needed along with your platelet-rich plasma to do what's needed in order to help you get an erection again. So, to summarize, we have a new treatment for erectile dysfunction that we've never had before. It is minimally invasive. It involves simply injecting material that we take from you back into you. It is not painful because we numb you with a lidocaine cream so that you can't feel your penis, and you can't feel us injecting into the penis with the needles. Now, I'll tell you that it's not painful because I've actually done it to myself. Yes, I numbed myself and injected this platelet rich plasma into myself, just so that I could tell you that it didn't hurt, and also to tell you that it does bring in more blood flow. It does do what it's supposed to do. So I've done it to myself. So this is not something I'm going to do to you that I've never done to myself. So if you're interested in this, click the link that's on this website that can either take you to Dr. Runels' website, where he talks about the procedure more and shows more videos, or you can click the link on this website and set up an appointment, or call our phone number and set up an appointment, and you can come in and we can have a consultation to decide if this is appropriate for you. Because I will tell you that it does work, and that it does increase blood flow, and that it does help men get erections where they've tried everything before. They have taken the hormones, they've done the pills, they've done everything except get a penile implant. So check the links, or call us, or check the box here that gets you an appointment. But if you're interested and you would like me to help you, come see me and let's get this taken care of. I'd be glad to help you, and I'm more than willing to take whatever time it takes to explain it to you. So thank you.